Chapter 7: Antibiotic Myths. You need to stop believing. Have you ever had a bad cold, sore throat, or the flu and thought, maybe I need antibiotics? Antibiotics are some of the most important medicines we have. They can treat certain bacterial infections and, in the right situation, can save lives. You're definitely not alone. But antibiotics are also widely misunderstood. Taking an antibiotic when you don't need one won't make a viral infection disappear. It can cause unwanted side effects and contribute to antibiotic resistance. So today, we're breaking down 7 common antibiotic myths you need to stop believing. And make sure you stay for myth number 7, because it's a very common mistake involving leftover antibiotics. Let's get started. Myth number 1. Antibiotics cure the flu. This is false. Influenza, commonly called the flu, is caused by a virus. Antibiotics are medicines used to treat certain infections caused by bacteria. Viruses and bacteria are not the same thing. Think about it like having 2 different kinds of locks. A key designed for one lock isn't necessarily going to open another. In a similar way, an antibiotic designed to work against certain bacteria isn't going to eliminate the virus causing influenza. The same principle applies to the common cold and many other viral respiratory infections. This is why your healthcare provider may tell you that antibiotics aren't necessary when you're sick. That doesn't mean your symptoms aren't real or that nothing can be done. There may be other treatments that can help manage your symptoms while your body recovers. The important thing to remember is simple. Antibiotics treat certain bacterial infections. They do not cure the flu or the common cold. Myth number 2, green or yellow. Mucus means you need antibiotics. You've probably heard someone say, "My mucus turned green, I must have a bacterial infection." But mucus color alone doesn't tell us whether someone needs antibiotics. When your immune system responds to an infection, mucus can change in color and thickness. Yellow or green mucus can occur during respiratory illnesses that don't require antibiotics. Healthcare professionals look at much more than mucus color. They may consider your symptoms, how long you've been sick, your physical examination, your medical history, and sometimes laboratory testing. So remember, green mucus does not automatically equal antibiotics. Myth number 3. Antibiotics make every infection go away faster. It can be tempting to think, even if I'm not sure what I have, why not take an antibiotic just to get better faster? Unfortunately, antibiotics don't work that way. If your illness is caused by a virus, taking an antibiotic won't cure the viral infection. And taking a medication you don't need isn't completely harmless. Antibiotics can cause side effects. These can include nausea, diarrhea, skin rashes, and sometimes serious allergic reactions. This is why the goal shouldn't be to get an antibiotic every time you become sick. The goal should be to receive the right treatment for the right illness. Remember, right medicine, right infection, better care. Myth number 4. Antibiotic resistance means your body becomes resistant. This is one of the most misunderstood things about antibiotics. When people hear the words antibiotic resistance, they sometimes think their body has learned to resist the medicine. That's not actually what's happening. Antibiotic resistance occurs when bacteria develop ways to survive medicines that were designed to kill them or stop their growth. In other words, the bacteria become resistant, not your body. When bacteria become resistant to antibiotics, infections caused by those bacteria can become more difficult to treat. Healthcare professionals may have fewer effective medications available. Some resistant infections can require different medications, longer treatment, or additional medical care. This is one reason responsible antibiotic use is so important. Myth number 5. Taking antibiotics when you don't need them is harmless. You might think, what's the harm? I'll take an antibiotic just in case. There are several problems with this. First, every medication has potential side effects. You can experience side effects from an antibiotic, even if that antibiotic isn't helping your illness. Second, unnecessary antibiotic use contributes to antibiotic resistance. Antibiotics are incredibly valuable medicines. We want them to continue working when people truly need them. One way we can help is by using antibiotics only when they're medically appropriate and taking them as prescribed. So antibiotics shouldn't be treated as a just-in-case medication. Myth number 6. You can take someone else's antibiotics. Imagine someone in your family recently had an infection. Now you're experiencing similar symptoms. There are leftover antibiotics in the house. It might seem convenient to take them, but you shouldn't. Two people can have similar symptoms for completely different reasons. A cough, sore throat, fever, or congestion doesn't automatically tell you what's causing the illness. The medication prescribed to another person was selected for that person's medical situation. The type of antibiotic, dose, duration, allergies, other medications, and health conditions can all matter. Taking medication prescribed for someone else can expose you to unnecessary side effects or medication interactions. Prescription antibiotics should never be shared. If you're sick and think you may need treatment, speak with a qualified healthcare professional. Myth number 7. Save leftover antibiotics for next time. Here's a mistake many people make. They start feeling better, find some antibiotics left over, and think, I'll keep these. Maybe they'll save me a doctor's visit next time. But that's not a good idea. Your next illness might be caused by a virus. Even if the illness is bacterial, the antibiotic sitting in your medicine cabinet might not be the appropriate antibiotic for that particular infection. Using leftover antibiotics can also mean you're taking the wrong medication or an incorrect amount. Take antibiotics exactly as directed by your healthcare professional. Don't save antibiotics to treat yourself during a future illness. If you have unused medication, ask your pharmacist about appropriate medication disposal options. Final takeaway, let's quickly review what we've learned. Antibiotics are powerful and important medicines, but they're not designed to treat every infection. Antibiotics treat certain bacterial infections. They don't treat viruses such as the common cold or influenza. Green mucus doesn't automatically mean you need antibiotics. Antibiotic resistance means bacteria become resistant to antibiotics, not your body. Don't take antibiotics just in case. Never share prescription antibiotics with someone else. And don't save leftover antibiotics to treat yourself later. If you're prescribed an antibiotic, take it exactly as directed, and speak with your healthcare professional or pharmacist if you have questions. Responsible antibiotic use helps protect you and helps preserve the effectiveness of these important medicines for the future. How many of these antibiotic myths had you heard before? Tell us in the comments. And if you enjoy simple explanations of confusing health topics, subscribe to Health Made Simple. We break down health myths, medical facts, and everyday health information without all the confusing medical talk. Thanks for watching, and we'll see you in the next video. Educational disclaimer. This video provides general educational and informational content only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always speak with a qualified healthcare professional about questions concerning your symptoms, medications, or individual health needs.